washing my hands. Hi, my name is Carla. I'm one of the nurses in the office today, and today I'll just be doing an examination of your respiratory system before the doctor comes in to see you. Is that okay? It'll probably take about 5 or 10 minutes.
Yes.
Okay, thank you. Can you tell me your name?
Carmen Anderson.
Okay, thank you, Ms. Anderson, and your date of birth.
12/24/80.
Okay, great. And can you tell me what today is?
It is Sunday.
And what year it is?
2020.
Okay, great. So we have 39-year-old Carmen Anderson, who is alert and oriented times 4, and we'll go ahead and begin the examination. So, Ms. Anderson, tell me, do you smoke or have you ever smoked?
No.
Okay, and do you have any history of asthma, emphysema, or COPD?
No.
Okay, so the first thing we would do on Ms. Anderson, we see that her respiratory rates are normal and the rhythm of the heart is regular. We'll go ahead and start the inspection of the chest. The patient's shirt would be off upon inspection, and we will be checking the anterior of the chest, making sure that everything is symmetrical, and also on the posterior of the chest, making sure that everything is symmetrical. We will also make sure that the chest is shaped like a cone, which represents normal findings of the chest. And we will also check to make sure that the AP ratio and the transverse ratio is 2:1, which represents normal findings. Okay? And then also, upon inspection, we would have the patient's shirt off. We would check the skin for any lesions, any abnormalities, and make sure that we don't see anything that's abnormal there. So we'll go ahead and continue with the inspection, and we'll go ahead and do the palpitation of the inspection. So the first thing I'll do is go ahead and press on the anterior of the chest, and Ms. Anderson, just tell me if you feel any pain or abnormalities.
No.
Okay. Okay, and then we'll check the posterior of the chest. Any pain or abnormalities?
No.
Okay, great. And so then we'll also check the lobes of the lungs. So if you go ahead and raise your arm up. The left side has 2. Any pain?
No.
Okay, great. Now I'm going to step to the other side. We'll check the right side, and the right side has 3. So it's 1, 2, 3. Any pain or tenderness?
No.
Okay, thank you. Also, upon palpation with the patient's shirt off, we would check for cyanosis, which is bluish coloring of the skin, and pallor, which is paleness of the skin, making sure that there's no signs of difficulty breathing with the patient. We see that the patient's not slumped over, or she's not showing any signs that she's having trouble breathing. So now that we've completed the palpitation part of the examination, we'll go ahead and do the auscultating part of the examination. So we'll start at the trachea, and Ms. Anderson, I'm just going to have you lift your head a little bit, open your mouth just a little bit, and we take some deep breaths in and out. And again. Okay, and we'll check the other side. Okay, great. And we'll go ahead and continue the examination. In and out. Other side. In and out. And while we're doing this, we're checking bilaterally so that we can compare both sides of the chest. And I'm sorry. And one more. Okay, great, thank you. And are you feeling okay?
Mm-hmm.
Okay, so next we're going to have Ms. Henderson stand. And we'll go ahead and check the posterior breathing sounds. And before we do the posterior breathing sounds, we'll check the expansion of the chest. And how we do that is, if you can turn just a little bit for me, thank you. And breathe in and out. Okay, and one more time. Okay, now you feeling okay?
Mm-hmm.
So we check the expansion of the chest, making sure that when the patient breathes in and out, that my hands move symmetrically. Now we'll go ahead and auscultate the posterior chest. And we'll start at the APCs at the top. In and out. Good. Good. And we'll also do this in the bilateral formation, comparing both sides. And you want to make sure that you do not auscultate over the scapula. And once again, the patient would be undressed. One more. And the other side. Good job. And the next thing we're going to do is we're going to auscultate the lobes of the lung. So remember that the right side has 3. 1. 2. 3. Good job. And we'll go ahead and do the left side. You can turn just a little bit for me, a little bit more. Okay, put the thumb up. Left side has 2. Okay, great. Go ahead and have a seat for me. Okay, so tell me, Miss Anderson, before I leave today, are you having any pain?
No, ma'am.
Okay, thank you. And is there anything else I can do for you?
No, ma'am.
Okay, and would you like for me to close the door when I leave?
Please.
Okay, well, this completes our examination, and I hope that you have a good day.
All right. Thank you.
Thank you. I'm sorry.
Mm-hmm.